Okay, we will continue the talk about the science. We say there is sometimes developing the iris cell. Cell is the presence of the white base cell in the anterior chamber. Can be calculated by magnification of the slit lamp to high magnification with high illumination source, and by this method we will cut cell in the anterior chamber. We calculate the number of cells. This is important to evaluate the patient because the clinical anterior uveitis classify according to the grade 0, 1, 2, 3, 4 according to the presence of cell. If we found 2, 1, 2, 2, 3 cell, this is maybe considered grade 1. If it's 5 to 10, grade 2, 10 to 25, grade 3, and more than 25 to 50, grade 4. Also flare that is occurred due to leakage of a protein and the appearance of from tapecular meshwork and cellular meshwork, and it is appear as smoky like. It appear as dusting، يعني تظهر مثل الغواش، مثل ترى يعني عدم وضوح بالسائل. Also from sign of anterior uveitis is the formation of nodules. We have Fusaka and Cobb nodules, and these nodules representing granulomatous inflammation aggregation. Now, what are the complications of anterior uveitis? The first of all is the formation of posterior synechiae. synechiae تعني adhesion، التصاقات. والالتصاقات اللي راح تصير نتيجة inflammation between the lens and the surface of the lens and the back of the iris lead to synechiae and the prevention, and subsequently will prevent the pupil movement, and subsequently will prevent aqueous of the flow. If it is more than 300 or it is 360 degrees, will be known as a condition of seclusion pupilli. Also from complication of uveitis is cataract formation and ankle closure on inflammatory uveitis. Now, the chronic sequelae of uveitis is hiatic bulbi that represent atropine of the ocular tissue as a whole, lead to hiatic bulbi. Cyclic membrane formation. Now, intermediate uveitis, the presenting symptom of intermediate uveitis is by definition is the inflammatory cell in the anterior vitreous space, and that lead to reduction in the visual acuity due to macular edema and vitritis. The signs is vitritis, cellular infiltration of the vitreous cavity. Possible complication: macular edema, cystoid macular edema, cyclic membrane, hiatic bulbi, cataract, and retinal detachment, fractional retinal detachment. Posterior uveitis. Also, this is presenting to us as flutters or impairment of vision, and نتيجة الفlutters or macular edema. The sign of examination number 1 is vitritis, يعني mean blurred vision. This is a dusty view. If it is clear, we can see the optic disc and retinal blood vessels, but now we cannot see because of vitritis is severe that blurred or prevent viewing of the posterior segment. Another presenting sign for the posterior uveitis is retinitis or papillitis. This is characterized by paravascular changes, white changes around the blood vessels. Also, vasculitis is inflammation of the retinal blood vessels, also considered a presentation for the posterior uveitis. Now, what is the possible complication? Cystoid macular edema, macular ischemia, epiretinal membrane formation, vascular occlusion, directional retinal detachment, consecutive optic atrophy or neuropathy. طبعا كل واحدة من هاي الكومبليكيشن هي بها يعني نقول تفاصيل هواية عن طريقة البرزنتيشن وشلون المريض يجي وشلون المريض يشوف وشنو اللي راح نسوي له وشنو البروجنوسيس مالتها. عموما اكيد من نوصل انه الى اوبتيك اتروفي او نيوروباثي مين انه وصلنا لاند ستيج، وبهيج حالة العين تقريبا اصبحت out of function. Now how to approach the patient with uveitis. The first of all, full ophthalmological assessment is needed to define the type of uveitis. Further investigation. نقصد full ophthalmological assessment mean an eye visual acuity measurement, refraction measurement, and intraocular pressure checking, and base corrected visual acuity, and slit lamp examination, posterior segment examination. Now, when we decide send patient to investigation, what investigation we send him? We send him hematological investigation such as complete blood picture, DSR, biochemical investigation such as random blood sugar, serum calcium, radiological. طبعا كل فحص وإلى هنقول فلسفته. بالمناسبة investigation لأني ما مذكورات in details في المحاضرة فكون ننتبه هنا. زين، فاحنا مثلا نساهم فور مثلا راندوم بلاد شوجر. الفكرة الأولى إنه مو بس نشوف لأن هو قبل شوي من جينا الاتيولوجيكال كلاسيفيكيشن وقلنا إنه الدايابيتس ممكن يعتبر cause for uveitis. Hematological evaluation we say sometime of uveitis occurs secondary tuberculosis, and we may find a systemic manifestation for that, or chest X-ray for sarcoidosis or for TB, lumbosacral spine X-ray for excluded spondyloarthritis, and serological C-reactive protein latex, rheumatoid factor, and additional for medical assessment. قلناهم قبل شوية إنه sacroiliac joint X-ray, chest X-ray, skull X-ray, seeking for calcification in case of toxoplasmosis. Sometimes we do skin test or famous test or pathology test in non-tox and keep them for sarcoidosis. The serum test such as antinuclear is and in case of uveitis, VDR or toxoplasmosis, EFAT and ELIASA, HLA typing خصوصا P27 for ankylosing spondylitis, and DYB51 for Behçet disease. Now, in general, any patient with uveitis, I will send him? No. Usually patients with uveitis, because uveitis common conditions, they are limited and occur without main cause, so no need for investigation except in the following condition. If it is recurrent anterior uveitis or bilateral anterior uveitis or severe anterior uveitis or anterior uveitis persistent or chronic or resistant to treatment, granulomatous type of anterior uveitis associated with bent posterior or intermediate uveitis, ocular suggested underlying disease such as the presence of back pain, presence of urethral discharge, presence of conjunctivitis, يعني مثلا شكين operators, شكين بنفرايتس وغيرها. Sometimes repeat infection for patient with previous negative investigation may be fruitful, مثمرة. Aim of a treatment now: prevent vision threatening complication, relieve discomfort and underlying cause if possible. Treatment of uveitis. Those 4 lines, and now we will discuss each of one on them. The first of them is use of mydriatics, second line is use of steroid, third line is systemic immunosuppressive agent, and the fourth is treatment etiology if possible, such as antimicrobial or antiviral treatment. Now, mydriatics. شنو الأيم مالتها؟ الأيم مالتها خلنا نعرف شنو الميدرياتكس. الميدرياتكس قبل شوي حكينا عنها انه قلنا البيوبل سايز will be enlarged. هل enlargement بالبيوبل سايز راح يوفر لنا عدة شغلات. أول مرة promote convert. ليش راح يسوي لنا convert؟ لأن راح يقلل لنا spasm of the ciliary muscle and بالتالي sphincter pupil فبالتالي راح يخلي الآي ريلاكس. الشغلة الثانية prevent formation of synechiae واللي عرفناها قبل شوي الادهيجن اللي يصير بين اللينس والآيرس. الشغلة الثالثة break down recently formed synechiae، يعني هسه مثلا المريض بدأت تصير عنده synechiae إذا newly formed من راح نعطيه mydriatic agent وراح يصير لنا break down. And some papers say that have an stabilizing blood aqueous barrier effect. mydriatics agent عالميا للميدرياتكس لازم يصير الهيد مالتهم. طبعا الهيد المفروض كل جروب اوف ميديكيشن انهن هيد كلر معين. الميدرياتكس يعني من نلقى قطرة الهيد مالتها الهيد كفر مالتها رد mean this is mydriatic agent. We have short acting group. short acting يعني يشتغل بسرعة والفترة التيرن اوفر مالته ايضا سريعة. والفيموس example هو tropicamide and cyclopentolate. Both of them have two concentration 0.5 and 1%. If the examined subject below 1 year we use 0.5, is more than we use 1%. long acting such as atropine. فكرة اللونج acting يعني يبقى الإفكت مال cycloplegic effect for 2 weeks، فلهذا نسميه long acting. We have also what is known as phenylphrine. Phenylphrine is mydriatic agent but have no cycloplegic effect. Also phenylphrine may affect on systemic blood pressure and causes elevation of blood pressure and sometimes tachycardia. So this is the first line. The second line in treatment is the use of steroids. والsteroids بمختلف أنواعها. We have topical steroid, we have the periocular or even systemic or even intravitreal injection. الآن الستيرويد هو العبارة اللي نريد نركز عليها، هو المينستي يعني الرقم الرئيسي من العلاج. قلنا ممكن topical, periocular, intravitreal or even systemic. Each of those have its advantage and disadvantage. يعني مثلا for example if we use eye drops for long period, topical steroid for long period, it may cause cataract, may cause glaucoma, cause corneal complications such as liability or activation of a previous fungal or viral infection and even sometimes systemic side effect. Sometimes we نلجأ إلى periocular steroid injection in cases of severe acute anterior uveitis or adjuvant to the topical or systemic steroid, or in cases of intermediate uveitis or patient poor compliance with topical or systemic steroid. هاي الطريقة نسميها subtenon injection. We open the conjunctiva and part of the tenon capsule that cover the eye and then inject the periocular injection of this eye. Epsilon is a type of steroid. In general, these are the systemic and ocular side effects: ocular glaucoma, cataract and corneal decomplication, and systemic such as dyslipidemia, mental changes, aseptic necrosis of the head, femoral electrolyte disturbance, Cushing syndrome as a long-term use, growth retardation, corticoadrenal suppression, reactivation of TB and osteoporosis. Sometimes we might use the immunosuppressive medication, especially in cases of sight-threatening uveitis or cases of steroid-sparing therapy with antimetabolites such as toxic agent azithromycin and methotrexate, or T-cell inhibitor such as cyclosporine and sacroiliac muscle. Thank you very much.